Von Willebrand disease is an inherited bleeding disorder that causes bleeding, bruising without there being significant trauma, nosebleeds, heavy menstrual periods, bleeding from the mouth, particularly after dental work, bleeding after surgery or after childbirth.
I was diagnosed when I was 11 years old. It was at the end of March break, and my mother was excited for me to go back to school. And I was upset because she was so excited. So I hung upside down on the monkey bars for as long as I could. And later that night I went to bed, and when I woke up in the morning, I had popped the blood vessels in my face.
We think that 1 in 1,000 individuals has von Willebrand's disease. One of the challenges with this condition, though, is that most don't actually know it.
I went to the doctors, and it wasn't chickenpox. They didn't resemble chickenpox, and I believe I went to a specialist, lots of blood work, and they found out that I had von Willebrand's, type 1, mild to moderate.
I'm always pleased when I make a new diagnosis of von Willebrand's disease because we have so many effective treatments to offer patients. In the very beginning, there was nothing available. Thankfully, we understand so much more about this disease now, and we have a range of possible treatments that go all the way from topical things to the most aggressive treatment is for us to give someone replacement therapy, primarily to prevent bad bleeding. So to stop bleeding into joints, to deal with very heavy periods.
I feel empowered by my doctors. I know my disease for myself. I know how to control my bleeds. I know what medication I need, lots of education.
Heavy menstrual periods are a real problem for women with von Willebrand's disease.
Because I'm female, my period is a big issue.
Defining abnormal clinical bleeding is one of the reasons that individuals with this disease go undiagnosed, because it's very difficult to do. So there's been a lot of work that's been done in the last decade to come up with clinical tools that we can use, bleeding assessment tools or bleeding questionnaires, which either we can administer to a patient or a patient could complete themselves and get a score as the amount of bleeding they're experiencing, normal or abnormal.
But I didn't know what normal was. Most women don't talk about their periods. And recently, my periods changed and I became anemic.
In the short term, when we meet patients and make a new diagnosis, we're very often dealing with patients who have iron deficiency anemia, who have been missing school or work because of difficulty with flooding associated with heavy menstrual bleeding. And we really are able to take those patients, institute appropriate treatment, and have them live a completely normal life.
It's very intimidating. It can impact your life quite seriously. What's normal? What's a normal period for a girl?
One of the messages I'm really hoping to get across is that there are individuals who have this disease but don't know it. Because we have such effective treatments, I want to try to identify those individuals who are maybe sitting at home having difficulty with bleeding and don't realize that with an accurate diagnosis there would be effective treatments available for them.
Talk. Talk about your period. Talk about your bleeding. Talk about bruising, ask questions, talk to your doctor.
I think a diagnosis of von Willebrand's disease is actually a very hopeful diagnosis because of the effective treatments that we have available, and because I know that we can take somebody who's really struggling with day-to-day bleeding and convert that individual into a happy, healthy, functional person.
Today it's good. Today I'm very happy, I'm very healthy, active, enjoying life. I don't let the von Willebrands slow me down for anything that I want to do.
For more information about von Willebrand's disease, help with early identification of abnormal bleeding, or to assess your risk, visit these websites.